All right. Hello, everyone. This is episode 3, and we are here to talk about health disparities.
Yeah, and for health disparities, according to the CDC, these are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations.
So essentially, it means that one group is having more issues than another group. This can be in the means of multiple things and ways. So an example would be like access to enough food, or having more diseases than another group, and etc.
Yeah, and a relevant and current example is COVID-19. And to be hospitalized for COVID-19, American Indians and Alaska Native individuals are hospitalized 5 times the rate as white people. Black people are hospitalized at the rate of 5 times of white people as well, and Hispanic or Latino people are hospitalized at the rate of about 4 times of white people.
That's insane. So Black people, American Indians, Alaska Natives, and Hispanic or Latino people are getting hit the hardest.
Yes, and many factors go into why they're affected the worst, and what we would need to look at are the social determinants of health.
What the hell is that?
Okay, for social determinants, these are conditions in health in which people work, live, age, and are born. Factors may include, but are not limited to, socioeconomic status, neighborhood, physical environment, access to healthcare, etc.
So it's like all the factors that can affect our lives, right?
And we can look at health disparities regarding socioeconomic status here in the US. And according to data research by the American Psychological Association, about 39% of African American children and adolescents and about 33% of Latino children and adolescents are living in poverty. This is about twice the poverty rate for non-Latinos, Asian, and white children. Alaska Native and American Indian, Hispanic, Native Hawaiian, and Pacific Islander families are more likely than Asian and white families to live in poverty.
Damn. Okay, well, that's just one thing. How about education? Some people say that education can be a tool to get out of poverty, right?
Latinos and African Americans are more likely to attend schools high in poverty compared to Caucasians and Asian Americans. Due to the lack of financial resources to schools that are high in poverty, African American students who are excelling in school are exposed to less advanced courses and school activities, which can also result in teachers that expect less of them academically than compared to Caucasian students.
Oh, crap. Well, COVID-19 is just one disease, right? They can't be leading in other diseases, right?
Ethnic and racial minorities face worse overall health outcomes and higher rates of the same diseases compared to white Americans. Health disparities are derived from the lack of affordability to healthcare or the environments they are in, as they have fewer resources and less access to care.
Well, damn. Why are these ethnic groups always getting the short end of the stick?
And the social determinants align with these issues, but another key issue is systemic racism.
Oh, so a lot of American neighborhoods have homogeneous racial and ethnic backgrounds. This limits individuals the opportunity to learn from different people who are ethnically and racially different from themselves. We live in an area, we live in an era where united we may stand, but we just stand in separate sections.
And most of the time, African Americans and Hispanics tend to live in areas where it's not as affluent of white neighborhoods. Therefore, they're stuck in a cycle of staying in their neighborhoods and it's more difficult to get out.
So now we're into our section of the episode where we'll be sharing our opinion. And our opinion for today is, how do we feel about racial disparities? And I think Sidhar would like to start.
Yeah. And when thinking about this, the first question that I ask myself is, do health disparities and different health outcomes exist for different racial groups? And statistics, just we don't have all of them right here, right now, but the answer is yes. And that's not really a debate that happens because the data is there that there are certain groups that have just worse outcomes in both health and income and things like that. The statistics are there, and there doesn't seem to be a debate on that, even between conservatives and progressives. And even if we can all agree on that, the debate that I've heard, at least from some conservative points of view, seem to be how in control different people and communities have over their conditions and success. So I think these conditions might come from one of two things. Either we believe, for example, the Black community naturally have worse outcomes for health, education, income, etc., and it's part of their culture. I honestly think that this is essentially a racist view for thinking one group is not as capable. And the second view, on the other hand, is that there are factors and like many other factors at play, such as systems in our country and communities that make it more difficult for certain groups to achieve success. In this case, can we allow these conditions to exist, especially as a wealthy and uh, pretty much more developed country than a lot of the world? I don't think so. And there are many examples of different conditions and outcomes, especially in health, just so many. Of course, income to even afford insurance and care is one of them. This makes it more difficult for certain communities to afford insurance, medicine, regular health appointments, other procedures, and so on. And even difference in care. So even if these groups can afford care, the quality may not be as good, or they may be mistreated in some way. Within the industry, for example, physician salaries and other positions, people of color statistically make less, and even in the same positions when compared to white people. Less representation and this lack of diversity and potential understanding of certain cultural groups may lead to lack of cultural competency of care for many of these groups. These factors and more can lead to worse health outcomes, especially to those who don't speak English like many of our family members, and can definitely lead to worse outcomes for African Americans. And these worse health outcomes have been occurring for a long time and continue to occur. There are many improvements to be made and many ways to go about it, but I think improving access and affordability for healthcare is one solution. This is what Obamacare tried to help, and what universal or single payer healthcare can improve for everyone, especially for African Americans and other minorities. And I think that's it for me. How about you, Noah?
You put a lot of valid points, like, like, as you could say, there's a lack of diversity in communities, as systematic racism can do that and create that. And for me personally, I I just personally believe that it stems through history, of course, like, where African Americans and Hispanic people are technically like stripped away from their land, as you can see back in the past, during the times where, you know, slavery was still around, and like throughout time, like African Americans were taken away land. Example would be like Tulsa. That's like a big one that people also like point out straight away. But I believe it's follow the money in a sense. Wherever the money is where more influence and more affluent people will be at, right? And like we live in a generation where, as I said before, where we might be united in this, like, in this nation, but we live in separate sections, right? We have Chinatowns, we have Vietnamese towns. We create these different diverse communities that don't really clash with each other. Like, as you could see, a lot of like millennials or people um are typically the ones to take a stand, right? To make ask for differences. Because we go to school with these people. We're forced to interact with these people. We live in the United States where we believe in individualism over collectivism, where our our thoughts and what we do go first. And I think that's the issue right there. Why should I care about these people, right? Why should I care about these communities? These are the questions that we have to ask ourselves. I care about these communities due to the fact that if these communities thrive, economically it'll be better. It'll be a safer environment just for not just the individuals that live there, but my family as well. If I visit and go around these areas, I want to be able to go to different cities and different towns and not be afraid to say that, oh, these are where poor people live, or these are where the black people live, or these are where the Latinos live. I don't want to say that. I don't want to live in a society where we have to point fingers at where everybody has to live. Oh, like these groups get worse cases of this, or ways like they don't get enough of that. Like, what am I like? How am I supposed to be able to live comfortably knowing that other people around me are starving or not having enough access to healthcare? So in my mind, what racial disparities like that kind of like irk me is just the involvement of money and how it kind of shapes our communities in that sense. And then another example, like lastly, for like what I want to say is that an example like Silicon Valley, right? All these families are getting kicked out because big tech companies are coming in, right? They can't pay goddamn rent anymore, but tech people can. Like these are examples of like how money, in my mind, in my opinion, is shaping our communities to be systematically like divided or systemically divided, to be frank. So yeah, that is my opinion. So we would like you to kind of share your opinions and kind of like share videos, share facts in the comment section or tweets, or like just talk to other people about this, because this isn't something that's new. It's always been here. And I feel like it's a great time for us to have a conversation to see what kind of change can be instilled into our society. Um, to our senators, to our mayors, to our townspeople, send out these bills, send out these letters to change policies to make a change. And next week, we'll be talking about Title IX. And thank you for listening. And please do share this video with others and also speak up your mind.